My name is Alai Tonwajo. I'm going to be performing a skill video for oral medication. So, firstly, I'm going to verify my provider's order, and secondly, I'm going to be checking for my six rights of medication, right dose, right documentation, right drug, patient, route, and type. And I'll be checking my medication for 0900, and right now I'm going to check EHR, electronic health record, for the orders. So I have potassium chloride, 20 milliequivalent. So I'm going to be checking for expiration date to make sure medication is still intact, and this will be my first medication check. And I have acetaminophen, 500 milligram per 15 ml. I'm going to make sure like the dosage is the dosage the dosage is 20 milliequivalent. So I'm going to confirm that to the EHR to make sure I have the correct dosage and the routes. This needs to be swallowed, and this is liquid. So I have that. I have my first check of medication, and after that I'm going to gather my supplies. I get some water for the patients to take the medication. I have my glove and I have my cup. Alright. Knock knock. Hi Mr. Sam, my name is Oluwajon. I'm going to be your nurse for today. I'm going to provide privacy for the patients. And can I confirm your name and date of birth? Okay, I'm going to confirm using the patient's wristband. Do you have any allergies to any medication, food? Oh, okay. So I'm here to give you your medication for 0900. And now I'm going to check the second medication check will be done before I leave the medication room, and the third medication check will be at the bedside before administering the medication to the patients. Alright, so I have your medication with me. I have potassium chloride. Potassium chloride is an electrolyte. It's for replenishing electrolytes. The common side effect for that will be nausea and vomiting and um, nausea, vomiting, and if you feel, and also I want you to make sure you give me a call light when you're having any adverse effects such as tingling, if you have any black tarry stew, and just give us a give us a call, and we'll be able to report that to your provider, and we'll be able to check on you. If you have any difficulty breathing, just let us know. Do you have any questions for me? Okay. And I have your Tylenol here for your pain also. So now I'm going to perform antigen. I'm going to position my patient to sit upright or sit at the side of the bed. So I'm going to perform my third check of medication with the EHR. I have potassium chloride and I have Tylenol 500 milligrams. So I'm going to peel this right there. Trash. So this medication, you cannot chew it. You cannot chew it. You have to swallow this medication for me, okay? Do you want it in your hands or you want me to put it in your mouth? Okay. So I'm going to, if the patient decide for me to put the medication in their mouth, I'm going to put it in their mouth, and if the patient decides to take it by themselves, and that is fine. And before I administer the medication, if it's a medication that needs any of the assessments like vital signs, I'm going to do that. But for this medication, it doesn't need any assessments. So make sure you swallow the medication. Can I see your mouth for me? Oh, nice. You swallowed the medication. And for the Tylenol, I'm going to assess for pain. Can you tell me your pain, your scale, rate your pain for me from 0 to 10? Oh, okay. So you're in a lot of pain. All right. This medication is going to help you with your pain. It's acetaminophen Tylenol. It's going to help you with your pain. Okay. And this is 500 milligram per 15 ml. So I'm going to be administering 15 ml because the order says 500 milligram. If the order says 1000 milligram, then I'm going to be administering 30 ml. So right now I'm going to so this is the label. I'm going to be covering the label. And upside down. So I'm going to be administering 15 ml. Okay. So I don't know if you can see it. So right there is 15. Let me see. Yeah. So right there is 15 ml. Okay. So I'm going to administer this to the patient. And after that, the patient can swallow the medication through the mouth, and I'm going to wipe the patient's mouth to make sure she's good. And after that, I'm going to cover my medication. Discard my glove. And before I discard my glove, I'm going to make sure the patient is comfortable, is lying down. I'm going to document that the medication was given. And after that, I'm going to provide comfort to make sure the patient is good, lower the bed, and I'll come back to reassess the patient for pain, and I'll dispose my glove, discard all my things used, and I will provide privacy for the patients.